Okay, so this is after we have conducted, is it recording? Yeah, it's recording. Okay. This is after we have conducted our screening tool, the 3-point elbow joint screening tool, and we have selected our patient, which is Julia Landivar, a 20-year-old female who is a club tennis player at Baylor, and that's how she relates to our study population. As one of our pathologies is lateral epicondylitis of the elbow, which is common in tennis players. So Julia, the reason why we selected you is because of your range of motion values. So if you look to the screen, I have the ranges detailed here versus what your values were, and I'm going to explain that to you real quick. So for flexion, this motion that we had measured for you, the full range is 130 degrees to 154 degrees, and you fell in the lower limits of that in both your dominant arm and your non-dominant arm, and that's where we drew concern, because really you should be closer to the 140 range in both. And then for extension, you were at 0 degrees, so that's extension. You're at 0 degrees in both your arms, where the full range is -6 to 11 degrees. And then your pronation in your dominant arm was actually fine, but in your non-dominant arm, it's at the lower end because the range is 75 degrees to 85 degrees, which 84 degrees in your dominant arm, good. But the 69 degrees is where we drew concern on that. And then, so your pronation and then your supination, once again on the lower end of 79 degrees and 82 degrees, where the full range is 80 degrees to 104 degrees. And so we have developed a 3-stage program for you to help improve your range of motion. And we've developed 2 short-term goals for you and 2 long-term goals for you. And now we are going to discuss our 2 short-term goals for you.
Before we dive into the 2 short-term goals, I would like to mention to you, Julia, that we'll be measuring your measurements 3 times throughout this whole activities, which is going to be the baseline measurement. So this is going to be happening before you start any exercises. And then we're going to have a midterm measurement, which we're going to measure in week 4. And then we're going to have a final measurement at week 8. And we're going to be measuring your passive and active range of motion with dominant and non-dominant hands. And to dive into the short-term goals, first, we want to improve your range of motion through passive means. And we're going to do this by building strength in a safe, but in a slow manner. And then the second goal is to improve your range of motion through active means with controlled minimal resistance. And we do have like goals set up for week 4 and week 8. And like there's certain numbers that we want you to reach. But overall, for passive range of motion, we want your flexion to be 150 to 153 degrees, and then your extension to be -9 to -7 degrees, pronation to be 83 to 87 degrees, and supination to be 90 to 94 degrees by week 8. And for active range of motion for minimum resistance, we want flexion to be 147 to 149 degrees, and extensions to be -6 to -4 degrees, and then pronation to be 80 to 83 degrees, and supination from 87 to 89 degrees by week 8 by the time we are done with this thing.
So your last state, the 3rd stage, is also going to last 8 weeks. We're going to do the baseline measurement, the week 4 measurement, the week 8 measurement, and this is going to be active range of motion. So your goals for active range of motion at the maximal stage is going to be the same as the minimal stage, because in the minimal stage, we're not going to mess with your resistance levels, but in the active stage, we are. And that's supposed to mimic the forces that you may experience while in tennis, or like even exercising for tennis. So once again, by week 8, we want you to hit 147 degrees to 149 degrees in flexion. For extension, we want it to be between -6 degrees to -4 degrees. And then pronation, we want it to be between 80 degrees to 83 degrees, and supination between 87 degrees and 89 degrees. And our ultimate goal, and which is a long-term goal, is to alleviate the pain that you've experienced in your wrist, which, for more context, for those who don't know, Julia was in a car accident a few months ago, and she has experienced pain in her wrist joint. And that's one of the reasons why we were concerned. And also, we discovered in our research that elbow range of motion is directly connected to the load that the wrist joint experiences. So our hope is to improve range of motion through passive means and active means in order to alleviate the pain that Julia feels in her wrist. And now we will detail how we're going to do that through the passive means.
All right, so for passive range of motion, to increase that, we're going to be using 6 different stretches. And just to give a little peek, for the first stretch, we're going to make you bend your arm 90 degrees, and we're going to make a clinician or your partner push it in for like 10 to 15 seconds, 10 to 15 times for one set. And you're just going to be doing this every morning or evening whenever you're feeling comfortable. And by doing these kind of stretches, we're just trying to make you relax your muscles and relax the elbow joints and everything. And then by doing so, we are hoping that it might also cause you to strengthen your muscle as some perspective. So yeah.
So after the passive stage, as we've mentioned, you'll have the 2 active stages. So the passive stage is more focused on improving flexibility, and you will do that with the assistance of a clinician or a partner. And the active range of motion, we would recommend the partner and the clinician just so they can monitor your motions, because again, the only way that improvement will be seen is if every exercise is performed correctly. So within both of these 8-week stages, the exercises will be performed every other day, with the stretching from the passive range of motion stage being done on those off days. And so the exercises you will be performing are tricep dips, hammer curls, pronation and supination twists, and the other was escaped me, skull crushers, and seated incline curls. So all of these are meant to imitate some form of range of motion. So some will focus on flexion, others will focus on extension, and then the pronation and supination twists focus obviously on pronation and supination. But in the active range of motion, I kind of mentioned this earlier, we're going to keep you at a fixed resistance. So with the resistance band, we'll see whichever one you can accomplish the motions in the correct form and without experiencing pain. We're going to have you stay at that resistance the full 8 weeks. But once we get you to the active range of motion, you're going to decide, you're going to have a baseline weight to start with at week 1, and then you're slowly going to increase. And the goal is not to lift heavy, but it's to lift a maximal amount of weight while performing the exercises correctly and not experiencing pain. And during both active stages, we will provide you with a pain scale in which you will rate your pain on 1 to 10. And you will state what stage you're in, what week of the stage you're in, and then what day you are in. Just so we can monitor all of that. So like if you hit a certain weight and you start experiencing pain, we'll be like, okay, we need to develop that one a little bit more. And regression is possible. And if we need to modify the amount of reps or sets, that is possible. And it is a caveat we have added to the treatment plan, because the goal ultimately is, again, to just improve flexibility and strength around your elbow joint so that it will also help your wrist joint. So that is our education on the findings. That is our patient goals, and those are the interventions we are going to use. Is there anything else you want to add?
Have fun, Julia. Love you.
Have fun, Julia. Hopefully this will